Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 186,881 confirmed cases of COVID-19 in Canada and 60,692 cases in Ontario. Chatham-Kent has 371 cases and Sarnia-Lambton has reported 350 cases. Michigan now has 137,702 cases, with 14,754 cases being in Detroit. Today, we are reporting 2,743 cases of COVID-19 since March, an increase of 2 cases from yesterday. Of the 2 new cases, 1 is a close contact of a confirmed case and 1 is still being investigated. Please note that of the 10 cases reported yesterday, 1 case was transferred to another health unit region, bringing our total to 9 cases for October 13th. Of the 9 cases, 3 are healthcare workers, 2 local and 1 working in Michigan. 2 are close contacts of confirmed cases, 2 are community acquired, and 2 cases are still being investigated. Overall, 65% of our cases are male and 35% are female. 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39 years. 2,603 people are now resolved, and 64 cases are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. 2 workplaces are currently experiencing a COVID-19 outbreak. 1 is in the agri-farm sector and 1 is in construction. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Testing is available by appointment at select pharmacies in Windsor with specific criteria for people without symptoms. Please contact Shoppers Drug Mart Pharmacy for further information. Testing is also available by appointment at the assessment centres in Windsor-Essex. Testing at assessment centres is for those with at least 1 symptom of COVID, high-risk contacts as directed by our health unit, and workers or residents of a facility experiencing an outbreak as directed by our health unit. Windsor-Essex has 3 assessment and testing centres: St. Clair College Sportsplex, Windsor Regional Hospital Olette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. It has been approximately 4 weeks since the reopening of schools in our area. Everyone is working together to support the safe return to school. However, we would like to comment on the school pickup and drop-off areas, which are often congested and can be a bit confusing. We'd like to remind parents to follow guidance and protocols that have been put in place. If driving children to school or picking them up, parents should remain in their vehicle. Drop-off and pickup areas need to be monitored to avoid crowding. For parents walking or biking with children to and from school, they should maintain a 2-meter distance at all times from others, and avoid socializing or lingering during pickup and drop-off. Parents should also bring a mask or face covering and ensure that it is worn if physical distancing cannot be maintained. Please visit our website at wechew.org for further information about the safe return to school. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As the province is responding to the second wave of COVID-19 and are reporting roughly 700-800 cases every day, and raising alarm that it could lead to the same surge that we avoided with the first wave. Here in Windsor-Essex, we are monitoring the situation very closely and are reporting single-digit cases in most of the day, with the exception of few days that is also concerning and is triggering and is pointing to the fact that things can get worse here in Windsor-Essex too. Our high-risk areas continues to be the agricultural farms and the long-term care homes, and more specifically within the agricultural farm, the bunkhouses that these temporary foreign workers are living in. When we're talking about these temporary foreign workers and these bunkhouses, there are a number of different agencies and with different roles and responsibilities that impact these workers. Starting all the way from the federal government that authorize all these temporary foreign workers to come to the country and issuing them visas to come and with the specific restrictions of quarantining for 14 days before they are allowed to go to work. During the 14 days while they're living, and if it's a new facility, our health unit staff are monitoring those housing conditions to make sure that it meets the minimum standard that is set by the government to ensure that the safety of these workers are maintained. The municipality, coming down to the municipalities, the municipality have their own roles when it comes to the temporary foreign workers, ensuring that all the residences and accommodations meet these building code standards and meet the municipal standards as set out under their bylaws. Public health follows the guidelines that is set up by all these ministries to ensure that the public health requirements are met and those workers are housed there. The Ministry of Labor have their own roles in ensuring that the facility itself, the farms, it is following the standards that all the other workplaces are following and meeting all the requirements as set out by for all these workplaces. The Ontario Ministry of Agriculture and Food Regulatory Authority, they have their oversight directly to these farms in ensuring that all these farms are operated under their ministry and following all the guidelines of the industry. From a public health perspective, obviously, we are more focused on the prevention and mitigation piece. And as part of preparing for the second wave, what we have done so far is we have updated our farm order to ensure that we are setting up clear expectation for all these farm owners, operators, in ensuring the safety and well-being of their workers. More specifically, we are more concerned about how these workers are screened, how these workers are monitored for their symptoms, and if they develop any symptoms, how they can appropriately triaged and sent for healthcare assessment and or for COVID assessment as well. We're also doing many of these visits now to these farms, which we typically don't do. That's the Ministry of Labor, and that's the federal government. That's there through Service Canada. They do that inspections at the workplaces. But locally, knowing that all these workplaces, especially if they have a symptomatic worker, it can lead to the spread of the disease at the workplace and also at the bunkhouses. So our team of inspectors are visiting these farms and they have a plan to make sure that those visits are happening to ensure that all those things are in place. In addition, what we are doing is we are connecting with all these farms, and when we get a positive case, we start our enhanced surveillance and communication directly with the farms. So when we are connecting with the farms, we are making sure that they have all those protocols in place, and if they have any other individuals who would be at a high risk or who would be potentially exhibiting symptoms, we are connecting with them. We are offering and expanding testing to ensure that we are capturing all those people before it spreads further. And there's ongoing communication happens with the farm at that time to make sure that we're not missing any of those cases. If there is any evidence that there is a transmission happen in the farms, then we move on to declaring the outbreak at that farm, and then we move to the outbreak management protocol. That's where many of the partners that are working in the region, they come in and then they support the overall outbreak response in ensuring that these workers, if they require isolation, they are isolated. If they require any healthcare, primary care, or any follow-up, that can happen in an appropriate manner, in a safe manner, ensuring that all the languages and other barriers are met. And then if it exceeds further, it went into the crisis management response, where we have to make a decision whether the farm can continue on with the limited number of workers, or if there's a widespread transmission of the disease that are happening, and how we can protect these workers and how we can prevent the spread of the transmission in the farm. And in those situations, we work closely with all the different levels of the government, and it goes beyond the local response at that time, and the involvement of the ministries, MAFRA, the Ministry of Labor, all that happens, all that starts at the same time. Just wanted to add on the part that the Ministry of Labor also gets involved when we have a first case or in any of these farms. And then moving on from that crisis response to the recovery piece, where we are working with the farms to make sure that the return of all these workers can happen in a safe manner, and also to make sure that these workers are not causing any further spread at the farm, and the farm can safely operate or manage their business and go back to their baseline, and ensuring that all these workers are still following all those protocols, and all these workers are screened daily, regularly, to ensure that there are no one missing in the farm. So having all those systems in place, we hope that the outbreak that we declared in a farm last week, we are moving in the direction to contain it unless we identify new cases. There are always some concerns when we are dealing with those new cases. And in those situations, if there are any challenges, any concerns with the employers, we move further, we escalate it to a higher level, and then we take appropriate action as well. So right now we have one farm that we have declared the outbreak, and we are working with them very closely along with our other partners, and hoping that with all these measures in place, we will be on top of all the farms that are happening, but just recognizing the various complexity and the various engagement of all the players, the municipalities, the Ministry of Labor, the OMAFRA, Ontario Health, the hospital, the primary care, the municipalities. It is not as simple and not as straightforward as many people think. So I'll stop here and we'll take questions.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
No questions today, thank you.
Okay, any questions from CBC?
Yes, hi Dr. Ahmed. I'm just wondering if there's any rules or laws in place regarding wearing a mask at a business takeout window.
So good question. It really depends on what we are talking about the business, the takeout windows. So when I am thinking about the takeout windows, I'm thinking about a drive-through model where I am driving in my car and I'm coming in and I'm picking up my stuff, and the distance between the server and myself is clearly more than 2 meters, and they are using different devices that doesn't allow that direct interaction, either sharing the terminal or exchanging any food or any cash. They are using different methods to do that, but in a different type of takeout window, where when you're talking about the physical distancing piece that cannot be maintained, then obviously we would recommend that people should be wearing a mask. And if it's an indoor establishment, that's already, it's pretty clear that any kind of indoor mask have to be worn, and not only just based on our order, but now also under the Reopening Ontario Act, they are supposed to wear the mask. I think that answers your question. I don't know if you have anything else you want to.
Yeah, I guess I'm just wondering, like, in addition to that, can a business refuse service to someone at a takeout window who isn't wearing a mask if it is, let's say, more of like a walk-up rather than a drive-through?
So please don't listen to my advice, because I'm not a lawyer. What I can tell you based on what I know is a business establishment is a private entity. They can choose who they serve, how they serve, so it's entirely up to them. As far as the mask law or by our order is concerned, I already explained what it does, but to my understanding, please consult with your legal team. My understanding, a business can set up the rules, who they are serving, what kind of criteria they are setting up to operate their business.
That's great, thank you so much.
Any questions from AM 800?
Hi, good morning. Sorry, it was actually really hard to hear Teresa at the beginning. I'm just wondering if she could say the case counts again and how many. I know she talked about a case being transferred to another health unit, but it was just really hard to hear.
Okay, I will just reread the notes. So
Okay.
today we're reporting 2,743 cases, and that's an increase of 2 from yesterday. So of the 2 new cases, one is a close contact of a confirmed case and one is still being investigated. However,
Okay, sorry, quick question, Teresa. I'm just not sure if that matches up with the numbers that were on the website, because I thought yesterday it showed 2,742.
oh, so what you'll see in the next section, I'll explain that we did report 10 cases on October 13th, but 1 case was actually belonged to another health unit region. So it
Okay, so that's where the 1 is missing.
Yes, so it was 9 cases yesterday rather than the 10. And
Okay.
and do you want me to go on about the breakdown of those 9, or are you okay?
The breakdown of the 9 and then the breakdown of the 2 from today.
Okay, so the breakdown of the 2 from today, 1 is a close contact of a confirmed case, and 1 is still being investigated. Of the 9 yesterday, 3 are healthcare workers, 2 are local, and 1 is working in Michigan. And 2 are close contacts of confirmed cases, 2 are community acquired, and 2 are still being investigated.
Okay, perfect. Okay, thank you so much, Teresa. A quick question for Dr. Ahmed. I'm wondering in terms of other vaccinations, the flu vaccine and then like measles, mumps, rubella, the typical childhood vaccines, would you happen to know if there has been a decrease in those vaccines being administered just because of, people leaving the house and difficulty booking doctor's appointments and getting into the offices and stuff like that?
So you're talking specifically since the COVID started in early February. So obviously it's hard to give you an accurate number, but anecdotally what we can say is yes, that is true, that because of the virtual primary care model and some of these vaccines are delayed, but we have put out several messaging for this importance of immunization throughout this pandemic. Our team has put together a number of messages. We work together with our primary care provider to get the word out that these vaccines are still important. So as much as we fear of COVID, we also need to understand that there are other more deadly diseases out there and that can be prevented by the vaccine, and for those, vaccines are already available. So we obviously recommended all of that, and we don't have specific data at this particular time to tell you if what kind of decline we have seen. But definitely there are some decrease in the uptake, and we're hoping with our ongoing work with the primary care provider team and also with our messaging, we are supporting the families, the parents, to go and get their vaccine, the childhood vaccine, in a timely manner without any delays.
And so if, somebody has been putting this off because of difficulty getting an appointment or, not wanting to leave the house or whatever the case may be, is there any risk in getting the vaccines but just getting them later than they possibly should have?
Well, I think it really depends on your risk as well. So like, for example, if someone can reasonably claim that I'm not even going outside and I'm not meeting anyone, then if they say, maybe I can get it a week from now or a month from now, they may be okay, but it truly depends on your unique circumstances. I think if your child is still going to the school, if your child is still meeting other people, there is a risk. And you should be able to get to your primary care provider. And most primary care provider, they are taking, they're doing the screening. They are taking patients without any overlaps, and that allows very limited interaction with the rest of the people to get their vaccine. I got my child vaccinated at the primary care provider's office as well. and that went fine. So most people are going there, and there are primary care providers who are only accepting kids as well. So there are a number of options out there. I would definitely support not delaying it and get the vaccine on time.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. I'm just curious if an outbreak would be declared at a long-term care or retirement home if the staff member who tested positive was, say, housekeeping or a kitchen staff member.
So it really depends on the circumstances. If it's a one single case, and if the reason for the testing was the surveillance testing, as many of these long-term care home and retirement homes are mandated to do that ongoing testing. And if as a result of this testing, not based on the symptoms, if someone comes back positive and then we investigate it and there's just one case, and if we believe that there is no reasonable breakage in the use of PPE or any infection prevention and control measures, we may not declare the outbreak. But if there's more than one case, then we are more inclined to declare the outbreak and ensuring that everything else is in place. And this is all based on the guidance and the recommendations that are coming down from the province, and also based on our risk assessment and our information that we collect with these facilities.
And I know you present these numbers on Fridays, but just anecdotally today, are we still seeing a long wait to get test results back from the lab?
It is getting better, but still there is a delay. I think we were in a much better shape about a month ago, but then we started to see some decrease in the number of test results that are coming back to us within 24 hours and 48 hours. So there is a delay, but what we have seen last week, I think the situation is better, but we're not out of the woods yet.
Thank you.
Any questions from CTV?
Good morning. I am curious what the health unit's stance is on outdoor face masks. Provinces like New Brunswick, they're putting forward rules in place for outdoor face masks when 2 meter social distance can't take place. So just curious if outdoor face masks, a policy on that has been explored or if it's being considered.
Well, I think if you go back to our recommendations, I think long ago, even in June, before we put out for the commercial establishment, we made that recommendation that anytime when you are coming in close interaction with the people, you should consider wearing a mask without, if the 2 meters physical distancing cannot be maintained. The challenge is when we are talking about a policy or a law or a bylaw or an order, especially in those places where when you're outdoor and we want people to be outdoor for some reason for their physical and mental well-being as well, but ensuring that all those other things are in place as well. So ensuring that when you have all those things in place, and if physical distancing, there's a lot of opportunity for you to physically distance yourself, that you can do that, then it's great. But and we will recommend that you can wear the mask if that physical distancing cannot be maintained. But making it as a requirement, I don't think that we are there yet, and things can change. Given the transmission that we are seeing right now, I think the risk is more at the indoor establishment, and that's what the evidence is pointing right now, that the transmission are happening in closed, confined indoor spaces. That's what we are trying to prevent, and all these Reopening Ontario Act, our order is strengthening that to make sure that that kind of transmission doesn't happen in indoor spaces. So outdoor space, we are not exploring it at this time unless the evidence change and unless our situation changes as well.
Understood. Well, staying on the outdoor mask topic, I am curious also if you have any recommendations looking forward to Halloween and trick-or-treating, if you have any recommendations for parents and children.
Well, our team is working on providing that recommendation. We obviously, as a broad, generally speaking, our recommendation would be to avoid any kind of parties. any kind of parties, any opportunities for people to come in close contact with each other or gather in large numbers. So we would definitely discourage that to happen. But if people continue to choose to do that Halloween tradition in a safer way, we will provide some guidance in terms of how you can do it safely, what activities can be considered as high-risk activities, what activities you can consider as low-risk activities, and people can choose what they can and what they want to do. But obviously the background of all of it is, how do we protect our children? How do we protect our seniors? Especially if if children are knocking on the door and how they're interacting with them, they are at high risk. So I think our messaging we're trying to cover all of that in our messaging, and that recommendation most likely either will come on Friday or Monday.
Okay, thank you. I wonder how high risk throwing candy will be at children, but maybe you'll tell us on Friday. Yeah.
Any further questions from Blackburn?
No, just I guess further to the trick-or-treating comments. I know you said you're going to have some more detailed information at a later date, but Dr. Tam did come out yesterday and said that for most likely in most regions, trick-or-treating, as long as some rules are followed, could be considered a safe activity. Would you agree with that assessment?
Well, I think it really needs to talk about the activity as well, because previous years, even my kids, they're going down house to house in bunches, like 10, 15 kids all together with all these large goodie bags, and then they're just stealing candies from each other, grabbing candies from the bowl and running away, chasing after each other. So there are a number of things that happen in the Halloween. We all know that. So it really depends on the activity, if that can be contained in a way where the congregation is not happening, where the candies are distributed in a safer manner, where children are doing physical distancing. Again, all of those things are fairly difficult to manage. But if that can happen, there is a possibility that children can still participate. But there are other ways. Obviously, we're talking about virtual, like a lot of these things are virtual. Kids can have their own Halloween party on Zoom or any virtual network, and then they can still dress up the way they want. Parents can do a lot of the activities with their kids by themselves dressing up, or maybe doing some kind of a candy hunt or things like that. So there are a number of ways that we can see that happening, but it really depends on how these activities are maintained. So it's hard for me to make a generalized statement and say that it's safe activity or not.
Okay, thank you.
Any further questions from CBC?
I'm all good, thank you.
AMA 100?
Right, can you just say again how many active cases there are right now?
64 active cases.
Okay, and one person in hospital?
Yes.
Okay, thanks, Teresa.
You're welcome.
Any further questions from the Windsor Star?
Yes, Teresa, just to check in on the flu vaccine distribution, is the health unit still receiving regular shipments, everything going smoothly and as expected in that department?
Yes, the vaccine distribution is continuing, and we are getting our shipments from the Ontario government pharmacy.
Thank you.
Any further questions from CTV?
No, thank you.
Thank you, everyone.
Thank you.